Hello everyone, welcome to another episode of Plant Protection. Today, we're going to explore something very important, artificial birth control.
Artificial? What do you mean? Isn't birth control just about stopping pregnancy? And aren't there natural ways to do it?
Great question. Birth control can be either natural or artificial birth. Today, we're focusing on artificial birth control, which uses for medical foods, devices, and hormones to prevent pregnancy.
Think of it like this. Some methods act like a shield, stopping sperm from meeting the egg. Others work like a switch, stopping ovulation. And some changes the body's environment, making pregnancy harder to happen.
Artificial birth control has 4 major types. Let's take a look.
First, barrier methods. These create a physical barrier to stop sperm from meeting the egg. The male condom is the most common barrier method. It's a thin sheet made of latex, polyurethane, or natural materials worn over an erect penis before intercourse. When a man ejaculates, sperm stays inside the condom, preventing it from entering the vagina. So now, let's discuss on how to use a male condom correctly. First, check the expiration date and make sure that the package is intact. Next, open carefully and don't use sharp objects. Next, pinch the tip before rolling it onto the penis, in which this leaves a space for the semen. Next, use water-based lubricant and don't use oil-based, in which it can damage the condom. Next, after ejaculation, hold the base and remove it carefully. So now, let's tackle about the advantages and disadvantages of using male condoms. First, let's tackle about the advantages. First, it is 98% effective with perfect use and 85% with typical use. Next, it protects us against sexual transmitted diseases. Next, it is affordable and widely available. And next, it has no prescription needed. Now, let's talk about its disadvantages. First, it can break or slip if not used correctly. And next, some people are allergic to latex.
Do you see that?
I didn't know there was a female version.
Yes, the female condom is a soft, flexible pouch inserted into the vagina before intercourse. It has 2 rings, one stays deep inside near the cervix, and the other remains outside to prevent slippings. Like the male condom, it blocks sperms and helps to prevent STIs.
How to use a female condom correctly? First, open it carefully and check for damage. Hold the inner ring, squeeze it, and insert it to the vagina. Make sure the inner ring stays outside of the vaginal opening. And lastly, after intercourse, twist it the outer ring and pull it gently.
Pros and cons of a female condom. The pros: protect against STIs. Second, can be inserted or before intercourse. Third, give woman control over protection. And the cons: first, 79% effective with typical use. Second, more effective and harder to find. And lastly, some people find it uncomfortable.
Another barrier is the spermicide. It is a type of contraceptive that works by killing sperm or preventing it from reaching the egg. It is available over the counter and comes in various forms, such as creams, gels, foams, films, suppositories, and tablets.
How to use spermicide correctly? First, read the instructions on the package to ensure proper use. Second, insert it deep inside the vagina near the cervix using your fingers or an applicator if provided. Number 3, wait for 10 to 15 minutes before intercourse to let the spermicide activate. It is the most important for suppositories and films. Number 4, use a new application each time you have intercourse. Spermicide does not last for multiple uses. Number 5, do not douche or rinse the vagina for at least 6 hours after sex, as this reduces effectiveness.
Pros and cons of spermicide. Available without a prescription. Easy to use and carry. It enhances effectiveness of barrier methods. It does not affect hormones. Lower effectiveness when used alone. May cause irritation or allergic reactions. It does not protect against STIs. Frequent use may increase the risk of urinary tract infections or UTI.
It looks different from a condom. How does it work?
A diaphragm is a soft silicone dome that covers the cervix to block sperm. It must be used with spermicide to increase effectiveness. The cervical cap works the same way but is smaller and fits more tightly over the cervix.
How to use diaphragm or cervical cup correctly? First, apply spermicide to the inside of the device. Second, fold and insert it into the vagina, covering the cervix. Third, leave in place for at least 6 hours after intercourse. And lastly, do not leave it for more than 24 hours to prevent any infections.
Pros and cons. Pros: reusable for up to 2 years. Hormone-free. Can be inserted hours before intercourse. Cons: requires fitting by a doctor. Does not protect against STIs.
A sponge for birth control.
Yes, it's a soft foam disc soaked in the spermicide. It blocks the cervix while releasing spermicide to kill sperm. And it's a double defense, blocking and killing sperm.
How to use a contraceptive sponge correctly. First, moisten with water to active spermicide. Second, insert deep into the vagina covering the cervix. Third, leave in the place for at least 6 hours after intercourse. Fourth, do not leave it for more than 24 hours.
Pros and cons. Available without a prescription. Can stay in place for up to 24 hours. Does not affect hormones. And 76 to 88% effectiveness for women who give birth. Must be left in place for 6 hours after intercourse. And does not protect against STIs.
But did you know that some birth control methods don't rely on physical barriers? Instead, they use hormones to prevent pregnancy before it even begins?
So you mean this method works inside the body?
That's right. Hormonal methods prevent ovulation, so there's no egg for sperm to fertilize. Let's go through them one by one.
The pill prevents pregnancy through multiple biological effects. First, estrogen suppresses the release of gonadotropin-releasing hormone from the hypothalamus. This stops the pituitary gland from producing follicle-stimulating hormone and luteinizing hormone, which are necessary for ovulation. Without an LH surge, the ovaries don't release an egg.
Meanwhile, progestin thickens cervical mucus, creating a vicious barrier that sperm struggle to pass through. It also makes the endometrium thinner, reducing the chance of implantation if fertilization does occur.
So you have to take it every day to keep your hormones level steady?
Exactly. Inconsistent use can cause hormone fluctuations, allowing ovulation to happen and increasing pregnancy risk.
The pros: highly effective with perfect use 99%, helps regulate menstrual cycle by stabilizing hormone levels, can reduce menstrual cramps by decreasing prostaglandin production. The cons: requires daily adherence for effectiveness, doesn't protect against sexually transmitted infections or STIs.
So, the patch works like the pill, but through the skin?
That's right. The contraceptive patch is a transdermal system that continuously releases estrogen and progestin into the bloodstream through the skin.
The hormones diffuse through the skin into capillaries, where they enter systematic circulation. Just like the pill, estrogen inhibits FSH and LH production, preventing ovulation. Progestin thickens cervical mucus and alters the uterine lining.
You wear one patch per week for 3 weeks, then take a 1-week break.
But what if it falls off?
If it's been off for less than 48 hours, you can reapply it. But if it's been longer, hormone levels might drop, so a backup contraceptive method is needed.
Pros: no daily pill to remember. Steady hormone release for consistent effect. Can be removed at any time for a quick return to fertility. Cons: skin irritation at application site. Slightly higher risk of blood clots due to continuous estrogen exposure. Doesn't protect against STIs.
The vaginal ring is inserted into the vagina where it releases estrogen and progestin continuously for 3 weeks. The hormones are absorbed through the vaginal mucosa, entering circulation directly and bypassing the liver. Like other combination methods, estrogen prevents ovulation by inhibiting FSH and LH secretion, while progestin thickens cervical mucus and makes the endometrium less receptive to implantation. The vaginal environment allows for equal distribution of hormones. After 3 weeks, remove the ring, then take a break for a week. Then insert another one. The pros: only requires monthly maintenance. Second, it bypasses the digestive system, reducing gastrointestinal side effects. Lastly, it can regulate menstrual cycles and reduce cramps. The cons: it must be inserted and removed at the right time. Second, it may cause vaginal irritation or discharge. And lastly, it doesn't protect against STIs.
This one's an injection, right? The birth control shot, like Depo-Provera, contains only progestin. It's injected into a muscle and provides protection for 3 months.
The progestin is stored into muscle tissue and released slowly into circulation. It suppresses the hypothalamic pituitary ovarian axis, preventing FSH and LH secretion, which stops ovulation. It also thickens cervical mucus and alters the uterine lining.
But what if you forget to take the next shot?
Missing a shot for more than 2 weeks reduces its effectiveness, so backup contraception may be needed.
Pros: long-lasting, only 4 injections per year, can reduce heavy menstrual bleeding over time, doesn't require daily or weekly maintenance. The cons: must be received on time every 3 months, can cause bone tendency loss for prolonged use, take months for fertility to return after stopping.
The contraceptive implant is a small rod inserted under the skin of the upper arm. It releases a steady dose of progestin for up to 3 years. The progestin is released at a controlled rate, maintaining a consistent suppression of ovulation by inhibiting LH. It also thickens cervical mucus and alters the endometrial lining to prevent implantation. And if you want to stop using it, a doctor can remove it anytime. The pros and cons of the contraceptive implant. Let's start off with the pros. First, it provides years of protection with one procedure. Second, it is highly effective with minimal maintenance. Third, the fertility returns quickly after removal. Let's proceed with the cons. First, it requires a doctor for insertion and removal. Second, can cause irregular bleeding, especially in the first year. Third, it doesn't protect against STIs. Previously, we tackled about hormonal contraceptives. Now, we are bound to another category that offers longer-lasting protection and even permanent solutions.
So now, let's dive into birth control that lasts longer and see how they work.
First, the IUD. It is a small T-shaped device inserted into the uterus by a healthcare professional. Scientifically, hormonal IUDs work by thickening cervical mucus, making it nearly impossible for sperm to reach the egg, while also thinning the uterine lining to prevent implantation. IUDs are highly effective, lasting from 3 to 12 years, depending on the type. The pros of IUD. First, highly effective over 99%, long-lasting, requiring no daily maintenance, and can be removed anytime with immediate return to fertility. However, it requires a healthcare provider for insertion and removal, possible cramping and spotting after insertion, and doesn't protect against sexually transmitted infections.
But can they be removed if someone wants to get pregnant?
Yes, that's what makes IUDs reversible. Fertility returns immediately after removal.
Now, what if someone wants permanent solution? That brings us to sterilization method.
First, tubal ligation. It is a surgical procedure for women that permanently prevents pregnancy by blocking or sealing the fallopian tubes.
Scientifically, This procedure ensures that eggs released from the ovaries can no longer travel to meet sperm, making fertilization impossible. Some techniques involve cutting in tiny tubes, while others use clips or cauterization to seal them.
Pros: permanent contraception, no hormonal side effects, highly effective in preventing pregnancy. The cons: requires surgery, which carries risk like infection or complications. Irreversible in most cases. Doesn't protect against STIs.
That's definitely a big decision to make. What about men? Is there a permanent method for them?
Yes, vasectomy is a male equivalent of tubal ligation. It's a minor surgical procedure that cuts or seals the vas deferens, the tube that carries sperm from the testicle, so that the sperm can mix with semen.
Scientifically, this means that ejaculation still happens, but the sperm is not present, preventing fertilization. However, the body still produces sperm, but they get absorbed naturally.
So here are the pros and cons of vasectomy. Pros: permanent and highly effective. A quick and outpatient procedure. No effect on sexual function. Cons: requires a waiting period for effectiveness. Some experience mild pain or discomfort after surgery. Not easily reversible.
So if someone is 100% sure they don't want kids, a vasectomy or tubal ligation could be the way to go.
But what if someone had unprotected sex and need immediate protection? That is where emergency contraception comes in.
First, the copper ID is inserted within 5 days after unprotected sex is the most effective form of emergency contraception, over 99% effective.
The copper ions immediately create a hostile environment for sperm, preventing fertilization. If an egg has already been released, the IUD also makes it difficult for implantation to occur.
Copper Pros: the most effective emergency contraception, provides long-term birth control after emergency use, non-hormonal option. Cons: requires a clinic visit for insertion, may cause cramping or heavier periods.
If getting an IUD isn't an option, there's another choice: emergency contraceptive pills, or what you call morning after pills.
These pills contains either levonorgestrel or ulprostol acetate, which delay ovulation. If ovulation hasn't occurred yet, these hormones prevent the release of an egg, reducing the chance of fertilization.
What if ovulation already happened?
Then, the pills are less effective. That's why timing is important. ECPs work best within 72 hours of unprotected sex, and some can work up to 5 days after.
The pros: available over the counter in many places, no long-term effects on fertility. Lastly, can be taken quickly after unprotected sex. The cons? The cons are less effective the longer you wait. Not a regular birth control method, and it can cause nausea, irregular bleeding, or headaches.
Birth control isn't just about avoiding pregnancy. It's about taking charge of your life and making choices that align with your future. Whether it's using a condom, taking the pill, getting an implant, or considering permanent options like sterilization, each method gives people the power to decide what's best for them.
Making informed choices about contraception isn't just a personal responsibility. It's a step toward a healthier, more prepared future. It's about making sure that when the time is right to start a family, it's done with readiness and intention, not by accident.
At the end of the day, being responsible doesn't mean saying no to possibilities. It means making sure we're ready for them when they come, because the best decisions are the ones we make with knowledge, care, and a plan.
This is Plan Protection, because your future is worth planning for.